John, I'm very glad to speak to you. And it turns out that you are the Assistant Professor of Nursing in UCD. Delighted to have you on the show. And what are your thoughts on all of this?
Yeah, thanks a million, Ciara. And it's really great to be having the conversation, I think. And like Dr. Rowley and other contributors, I think it's a conversation that we should have been having a lot earlier.
I agree.
It's information that the HSE should have been producing, and it was interesting when we were looking at originally the roadmap for reopening society and businesses. The sex was mentioned exactly 0 times within that. I think from my perspective, as Dominic said before, we know that people have been having sex. People have been having sex with their
But you can take
regular partners.
You can take that as a given, John, that people are always going to be having sex.
Absolutely, and I think many jurisdictions came out with this type of information well in advance. And in Ireland, many organisations, I'm involved in ACT UP, which is a grassroots organisation aimed to end the HIV crisis. HIV Ireland spun out. Many different groups and organisations were producing information. I think that's really good, but it's great to see the HSE now coming in and acknowledging that people are having sex. But I suppose my concern is on the other hand, where we went through a surge in COVID. I, like many other health professionals, were back in the front line. I was in ICU. I was hoping people weren't having very much sex outside their household at that time. But as things improved, we saw, numbers go down. But one thing we didn't see happen is the reopening of sexual health services.
Yeah.
And we're seeing now at a time when we really should, HSE is acknowledging lots of people are having sex. Our sexual health services, while they are opening slowly, we're still not at capacity. And while we're seeing a reduction in figures around STIs, they're down about a quarter on what they were last year. But that's test results, and we're not testing the same amount as we were last
exactly.
year.
And indeed, the thing is, we know that people will take risks. People have always taken risks. I can't remember, somebody was on with me earlier and they said, well, no, our main instinct is to survive. But actually, people will have risky sex that might even challenge their survival, because that instinct, I think, is probably the strongest one. But in fairness, John, you are the Assistant Professor of Nursing. I didn't know you were going to come on, and I'm delighted to talk to you. But NPHET, I heard both Tony Holohan and indeed other members of NPHET being asked at press conferences about this issue, about the advice that should go out to people in relationships where they don't live within the home, or who are sexually active and want to continue to be. And they, I have to say, kind of spoke out of both sides of their mouths, didn't really commit with any kind of hard or fast sort of advice on it on numerous occasions. Is it a case that we're just really, really uncomfortable about talking about sex in Ireland, so much so that even public health officials, when asked about the guidelines on sex during a pandemic, don't really know what to say?
Look, Ciara, we know, and you probably know this from your practice as a GP, while you're quite comfortable and open around talking about this, probably many people you worked with weren't. And we know that healthcare professionals are uncomfortable speaking about sex. And it's something I bring into my teaching with student nurses and midwives very often, being very, open and frank discussions, because we know also from research that if people have concerns around their sexual health or well-being, they often don't feel comfortable bringing it up and rely on the healthcare professionals to bring it up. So it's really important we have these discussions and that we are having frank discussions. And yeah, if you want to have phone sex or cam sex and all the rest, yeah, you need to know about the information on how to do it safely, as safe as possible. And organisations like Spun Out have some great information around that. But not everybody wants to have that type of sex. Other people, rely on the physical contact. And we know as well sex is good for you. There's clear empirical evidence that having sex is good for your health and well-being. But there are obviously risks involved.
Yeah. And
what we really need is the infrastructure to ensure that where those risks are there, that people can engage in protecting themselves as much as possible. And it comes down to education. And I thought it was interesting, you were pointing out the focus on young people. Lots of young people know this information. They're actually probably much more well-adept.
They've been sexting for years, right the way from school, let's be honest.
Whereas maybe older people may not be aware,
yes.
Where people who want to protect themselves and maybe are cocooning but still have sexual desires may not be aware of the risks.
I think you are exactly right. I think the young people are already having phone sex. I think perhaps suggesting it to the slightly older people, the middle-aged people, the older again people, that this is a way of maybe satisfying desire if they hadn't realised it themselves already, that's something that should be said. I think the conversation is ageist, actually. But look, thank you for speaking to us, and thank you for coming on. I do actually very much appreciate that. It's John, who's an assistant professor of nursing in UCD.